so the record's not on yet. Hi everyone. So today I'm going to be showing you guys an important skill I learned while learning how to become an EMT. So if you don't know, an EMT is an emergency medical technician, or the people that come in the ambulance and pick you up and take you to the hospital. So this is my patient, Ashley. She was just in a horrible car accident and she's bleeding to death from her arm. So I'm going to show you guys how to do bleeding control today, which you would use what's called a tourniquet. So basically what you would do is you'd locate the source of your patient's bleeding, and it's from her arm right here if you couldn't tell. So you would loop this up above the bleeding. So if her bleeding is right here, you'd go a couple inches above her bleed. Then you'd take the Velcro strap and you'd tighten it just to the length or the diameter of her arm. You don't want to go too tight because the stick portion here, you're going to use it and you're going to twist it until your patient, usually you would twist it and you'd feel your patient's pulse. And as soon as you can't feel the pulse in their wrist anymore, that's tight enough. You don't want it too tight where it's going to completely cut off circulation, but you want it tight enough so it stops the bleeding. And then you would loop it into one of these hooks here so that it stays in place. And then most tourniquets have this tab here where you would write the date and time that you put it on, because most tourniquets you can leave on for 6 or so hours. And so when you take your patient to the hospital, the hospital staff is going to keep this tourniquet on until the patient goes to surgery. So having the date and time for when it was put on is very helpful for them to know when they can take it off. So like I said, I don't work in the ambulance setting anymore. I work in the hospital setting. So these tourniquets are very helpful. If you're out in the field and you don't have a specific tourniquet, you can always use like a stick or a ruler or something, a pencil, pen, and like a towel or a shirt. And you would just tie the towel as tight as you can around their arm or leg or wherever. And you'd use your stick object and you'd weave it in so that you can make sure it's tight enough to stop the bleeding. So that is a very important skill that you learn in emergency medicine, and it can be very life-saving. So there's my demonstration for you guys. Thank you.